hard truth, and it makes for difficult listening. Have you ever seen anything like this before?
30 years as a medical practitioner and 10 years as a consultant. No, I've never seen anything like this ever.
I'm talking to an emergency consultant desperately trying to save lives in a South London hospital. He fears he's losing the battle against COVID-19. Are you worried?
I am. I'm very worried. It's actually quite horrifying to think that we could be completely swamped. We are professionals and we know what we're doing and we know how to handle stress, but it's a stress shock to the system where you know you are going to be in a situation where there are patients you could have saved in normal circumstances, but the resources are not there. The staff are not there. All of the things that you'd normally require will not be there to save these people.
We're protecting our doctor's identity and he's protecting our safety. He didn't want to meet after being exposed to patients with COVID-19.
Some people have described COVID as being like the flu. It really isn't, not the way we are seeing it. The unwell people are seriously unwell. We are getting people coming in with full-blown, really nasty pneumonia.
The capital is the UK's coronavirus hotspot. There are more deaths and positive cases here than anywhere else. Currently, is your intensive care unit full? Are you at capacity or will you be there very soon?
Actually, it has remained above capacity. We've got overflow. Any availability we are having is because of people dying.
The government's handling of the crisis has been fiercely criticised. The lack of testing, the lack of protective equipment, and the lack of clear direction on social distancing.
Most of my colleagues that I know, we're not setting out to be heroes, but yes, we are aware of the potential risks to ourselves. And it almost feels like you are slightly being used as cannon fodder, slightly expendable. If we fall sick, we are not available to treat anybody.
Our doctor has seen our report on the shocking situation in northern Italy. It is catastrophic there, but he has a grim warning for us here.
I actually think it could be worse than that, because I'm aware of the Italian system, and I think in quite a few ways they are in advance of us in terms of resources and the intensive care beds that they had available prior to this occurring. So I think we may actually end up in a worse state than they presently are unless we take sufficient measures right now. Maybe talking days, or probably more weeks, but possibly days.
Our doctor has agreed to speak to Sky News because he wants us to know what is happening right now inside his hospital. The situation is at crisis point, and we have yet to reach the peak. Ashish Joshi, Sky News.